Hello dear friends, how are you doing today? I hope you are doing well. Today we are going to talk about uncommon pigmented growths. Becker Nevus or melanocytosis is a brown patch with dark coarse hairs that occurs on the upper trunk and arms. It usually appears in teenage and young adult males. It has no malignant potential and treatment is for cosmetic appearance. Becker Nevus has no malignant potential, and this is an important point. Nevus of Ota or ocular dermal melanocytosis is a mottled or confluent brown blue-gray macule of the face that usually affects female Asians. Besides the skin, the eye can be involved with associated glaucoma. Onset occurs at birth, before 1 year of age, and at puberty. Malignant melanoma is a rare complication. Laser treatment can be cosmetically successful. Malignant melanoma is a rare complication of Nevus of Ota, and this is an important point for the evaluation of these lesions. We are going to evaluate some cases. Case 1, bleeding growth. This 29-year-old white woman was seen in the dermatology clinic because of a bleeding growth. It had been present for 6 months and had grown rapidly. Her medical history was otherwise unremarkable. What is your differential diagnosis of this lesion? This 6 mm nodule has the blue-black color and eroded surface typical of a nodular malignant melanoma. The differential diagnosis includes blue nevus, nodular pyogenic granuloma, and hemangioma. What would you do now? An excisional biopsy revealed histopathologic changes typical of a nodular melanoma invading to a depth of 3.7 mm. The remainder of the skin examination and a general physical examination were normal. A sentinel lymph node biopsy was free of tumor. A 2 cm margin of normal skin was excised around the biopsy scar. How would you determine the prognosis of this patient? The prognosis of malignant melanoma is related to tumor thickness. Because this is a thick melanoma, the patient's prognosis is poorer despite having negative sentinel lymph nodes. Important points: all bleeding pigmented lesions should be examined by biopsy, not merely washed. Patients with thick melanomas have a poor prognosis. Most melanomas can be removed and cured when they are thin if physicians and the public are alert to these diagnostic signs. Case 2, firm nodule. This 50-year-old man sought medical attention because of the large nodule on his right hip. Otherwise, he felt well. On examination, the nodule felt extremely firm. A healing excision from a recent biopsy was present. What is the most likely diagnosis? Malignancy must be suspected for all firm dermal nodules. A benign process would be particularly unlikely in this patient because of the size and firmness of their nodule. Do you see any other skin lesions of note? The patient was examined to search for the primary tumor. The physician noted on the patient's mid-thigh a small, darkly pigmented plaque with bluish color, irregular border, and white halo. Excision and histologic examination of this lesion revealed a primary malignant melanoma. Retrospective review of the original biopsy from the nodule showed it to be metastatic melanoma. Okay, this was a short explanation about uncommon epidermal growths, and also we evaluated 2 cases for malignant lesions. Thank you for your attention.